Hi, I'm Dr. Rob Rivera, and we're here at the Aspen Invitational Refractive Society meeting. We have the distinct pleasure of having a special guest of honor for this interview, which I truly hope you enjoy and get some very kind of an interesting perspective on what's been happening in refractive surgery. Our guest of honor today is Dr. Manus Kraff. He is visiting here from Chicago, and as I introduce Dr. Kraff, one of the things that I really want to point out is that there are very few individuals with the perspective on refractive surgery that Dr. Kraff has, given the number of years that he's been in practice, the various procedures that have been introduced during his famed career, and he really is one of those few folks who has seen it all. He has seen some procedures come and he's seen many go. At the same time, he's really had the advantage of being able to offer his patients what he believes is the best refractive option in many cases to get them seeing the best that they've ever seen in their life. Now, one of the things that we're going to be discussing today is one of the latest advances in refractive surgery, and that being, of course, the Visian ICL. Manus, you've had experience, as I say, with many procedures. Why don't you give me a little bit of your overall perspective? You sit in a very unique vantage point here of seeing so many things. Where are you now with respect to all of this?
You know, one of the things about growing older is that people say nice things about you. So I thank you very much for your kind introduction. I guess my history in refractive surgery dates back to September of 1980 when I went to spend a couple of weeks with Slava Fyodorov in Moscow. And at that time, it was all RK. And I spent 2 weeks there looking and observing RK. I came back and I bought all the instruments, but I never did the procedure. It was something that just wasn't right. And fast forward about 14 years later, I again went back to see Slava, but this time it was to look into the procedure that he was doing, which was mainly putting in a phakic IOL in the posterior chamber. And I had been asked by Star Surgical to go and evaluate the procedure and give him an honest opinion of what we saw. So I'll never forget, I looked at these patients as Slava brought out. We looked through the slit lamp, and the patients looked good. And I said, Slava, I says, these look terrific, but tell me, what happens if you get a cataract? Because it was the most obvious thing, something sitting right next to the human crystalline lens. And he looked at me, and he said, Manus, he says, you don't know how to take care of a cataract? And I thought at the time he was being very facetious. But really what he was saying was, so what? If it happens, we can handle it. And I came back and I really was amazed by what I saw. And Star Surgical at that time was deciding that they would enter the business. And so we started from there. And that was my first experience. It wasn't called the Visian ICL at that time, but it was called the ICL.
That's amazing. So 14 years ago, or 14 years after your first exposure, rather, to refractive surgery being incisional, corneal-based procedures, you got to see a phakic IOL for the first time. When you initially became exposed to the phakic IOL concept, that was a number of years back. Now that we're in the current age using phakic IOL, specifically the Visian ICL, what has your experience been? What are your opinions and impressions with being able to take the Star ICL and implant that into a patient with refractive error and give them the type of vision really that they're seeking for?
Well, I think your question really would be, to me, should be, what do I consider is the best way, the most perfect type of vision we can restore to a patient with refractive surgery? So I have to take you back and say, well, I think PRK is the second best way of performing refractive surgery and producing good vision. Well, I assume your next question is going to be to ask me, what's the best way?
What's number one?
And number one is the Visian ICL. Why do I say that? The patients see better. I don't think there's any question about that. The optics of a lens are better than the optics of a cornea that has been compromised with surgery.
Manus, another issue we oftentimes hear from our colleagues about is price. ICL is a more expensive option for patients to consider. The way I counsel patients is to say that it does in fact cost more, but so does a high-definition television set compared to a standard. If you want a standard definition TV, you'll be satisfied with that, but the moment you see high def, the most common response is, wow, why not get a high definition television? So if price were not an issue, and a -5 patient comes in to see you for a refractive consult, how would you approach that?
Well, price, of course, is always an issue right now. But if it's not an issue, I think the way you present it to the patient is the critical thing. One, you have to believe that you are giving the patient the best possible technology you can. So I think when you say to a patient, I think it would be an easy sell if price wasn't an issue, because you say, now, if you want to ask me what your vision will be best with, it's obviously an ICL. And so I think that part of it is an easy sell. The price thing is an issue, but I always point out to the patient that I'm not the increase in the cost of the price. It's basically, I don't have a surgery center, so it's the cost of the surgery center, the cost of the lens, so my price is about the same, okay? And I think that primarily is what rings true. If the patient feels that they're getting the best, I don't think that there's any issue that they would choose that. It's the problem. Price does play an issue here, and we have to figure at what point will the patient say, I am willing to pay extra for that procedure. You know, Macy's is probably the leading department store, but Saks Fifth Avenue and Neiman Marcus is still in business. People still do business there. More successfully treatable, not only easier on our part, but more successfully. I can more successfully treat a cataract than I can treat a corneal decompensation or an ectasia.
Absolutely.
It's easier, it's quicker, and with greater patient satisfaction. So a cataract is easy to treat.
Well, once again, we want to thank Dr. Kraff for being with us today. I hope you've enjoyed your experience here as we've discussed one of our favorite refractive procedures.
Well, I love picking your brains because, you know, Rob, I've come out and watched you, and I respect you. I can't tell you how much I respect you. And I always learn hand to hand, mouth to mouth, eyeball to eyeball, talking to somebody.
Well, thank you, Dr. Kraff. And once again, we hope you've enjoyed this on behalf of Star Surgical and the folks at the Aspen meeting. This has been a great experience, and please don't hesitate to contact Dr. Kraff or myself if you have any other questions. Likewise, the fine personnel from Star Surgical will be happy to answer any other questions as well. Thank you for watching.